Hi, I'm Dr. Diane Morris. I'm the medical director at Meridian Health Services. I'm going to talk a little bit today about some of the new things that we're seeing both in our detox units and in our outpatient setting. You may have read, I'm very concerned about the increase in fentanyl products. It appears that we've gone from heroin being imported from Asia, processed from poppies in the Middle East and brought in by illegal means, to more of a corporate operation. There's large factories that are using fentanyl from China and processing it in Mexico, and the cartels are coming up into our area. The more concerning thing as well is the rapid increase in methamphetamine. In Michigan, we used to see it in the middle part of the state, the western side of the state, rural areas, and it was sort of a homegrown operation, kind of like Breaking Bad. Started with small labs that got a little bigger, but it was individuals. Now what we're seeing is methamphetamine coming, again, most of the time from Latin America and Mexico in large amounts. These are being manufactured in factory settings. And the concern that we have is that fentanyl and methamphetamine are being manufactured together. And so a lot of the overdoses that we're seeing around, depending on what county and what part of the state and what part of the country, certainly in the western states, up to 25 to 30% of the overdoses on opiates have methamphetamine, which is really worrisome. Unfortunately, we do not have good medication-assisted treatment at this time for methamphetamine, though I will say that the NIH has funded a series of grants and research grants around the country looking for treatments for methamphetamine. These are worrisome drugs. One of the problems is fentanyl. The average heroin user, fentanyl user, opiate user, if they use enough of the substance, they begin to nod out and they really can't use anymore. When it's mixed with a stimulant like cocaine or fentanyl, what happens is they wake up and they can use more and more of the drug, hence the increase in overdoses. The other thing that we're seeing fentanyl in are handmade benzodiazepines and opiate pills. People can buy pill presses, and they're making fake Xanax, fake Klonopin, fake Norcos, fake oxycodone, and these pills have significant amounts of fentanyl in them, and again cause overdoses with small amounts. And this has been a problem again around the country, more and more in Michigan. So we're concerned about it. We do drug testing for fentanyl and methamphetamine in all our patients so that we don't miss these substances. And I can tell you that even 5 years ago, we didn't test routinely for these. So that's kind of the current state. Fentanyl is an opiate, so it is people who are using fentanyl, who become dependent on fentanyl, are candidates for medication-assisted treatment, both methadone, buprenorphine, and Vivitrol or naltrexone, the 3 approved drugs for opiate use disorder. I would say that probably at least 30 to 50% of our drug testing when people come in for treatment for opiate use disorder is positive only for fentanyl. The patients think they've been using heroin, and in fact, there are no opiates or heroin in their drug screens. We're here today discussing this courtesy of our friends at the Sports Marketing Agency and their efforts to raise awareness about mental health and substance use disorders.